Your cardiologist looked at your heart and found the problem. Maybe it was coronary artery disease. Maybe it was heart failure. Maybe it was an arrhythmia that kept coming back despite medication. And they treated it. Stents, beta blockers, antiarrhythmics, blood thinners, a treatment plan that addresses the heart from every angle cardiology has available. And your heart is still not right. Still struggling. Still throwing up numbers that concern your cardiologist enough to keep adjusting your protocol. Still producing symptoms on days when you should be feeling fine. Because your cardiologist is treating the victim. Your heart did not decide to develop coronary artery disease. Your heart did not decide to fail. Your heart did not decide to beat irregularly at 3 in the morning and wake you up with a sensation that makes you wonder if this is the night. Your heart receives instructions. Continuous, precise electrochemical instructions that govern every beat, every contraction, every adjustment it makes to the demands of your body. And those instructions come from above, from your brain. The same brain that after 60 begins to deteriorate in ways that send corrupted instructions to the most vital muscle in your body. That drives inflammation in your coronary arteries. That disrupts the electrical system governing your heartbeat. That activates the stress response that keeps your heart working at elevated output through the night when it should be resting and recovering. Your heart is not the problem. Your heart is paying for a problem that started in your brain, and your cardiologist has been treating the wrong organ for years. Today, I am going to show you exactly how that is happening, why it accelerates after 60, and what addressing the brain side of your cardiac condition could do for the heart your current treatment has never fully protected. My name is Dr. Angela Whitfield. This channel exists to show you what a rushed appointment never will. Everything I share here is for educational purposes only and is not a substitute for professional medical advice. Please speak to your doctor before making any changes. Drop your city or country in the comments right now. I want to know who is watching today. Before I take you through the brain-heart connection, I need to reinforce the principle that drives everything on this channel. The brain-first principle. Your brain is not just your thinking organ. It is your body's master control system. Every heartbeat, every arterial contraction, every hormonal signal that determines how hard your heart works and under what pressure your blood flows. All of it operates under direct or indirect instruction from your brain. When your brain is healthy, those instructions are precise, protective, and perfectly coordinated. Your heart rate rises and falls in exact proportion to demand. Your coronary arteries dilate and constrict in precise response to myocardial oxygen requirements. Your stress response activates when there is genuine threat and stands down completely when the threat has passed. When your brain begins to deteriorate after 60, those instructions become corrupted. Signals arrive at the wrong intensity. The stress response stays partially activated when it should be fully at rest. The inflammatory processes that damage coronary arteries receive insufficient inhibition from a brain that can no longer regulate them efficiently. And the result is a heart that is working harder than it should, in an environment more inflammatory than it should be, under instructions that are less precise than they need to be. Your cardiologist sees the consequences and treats them. Nobody is treating the source. Keep the brain-first principle with you as we go through everything I am about to show you. Let me tell you about Bernard. Bernard was 70 years old, a retired civil engineer from Birmingham, Alabama. Methodical man, the kind of person who had maintained his health with the same systematic precision he had applied to his engineering career. He had been diagnosed with coronary artery disease at 65. 2 stents placed in his left anterior descending artery. On aspirin, a statin, a beta blocker, and an ACE inhibitor. By every measure of cardiology, he was being optimally managed. But his angina kept coming back on days when his cardiologist could not fully explain why. His stress echocardiogram suggested ongoing ischemia despite the patent stents. His inflammatory markers were persistently elevated despite the statin. And over the same 5 years, his sleep had become fragmented and unrefreshing. His cognition had slowed in ways he attributed to the medication. His anxiety had increased to a level that his wife described as a different person. His cardiologist had never asked about any of those things. They were not on the cardiology checklist, and the checklist was the only lens through which Bernard's heart was being examined. 4 symptoms, 5 years, 1 checklist, and not a single question about the organ sending instructions to the heart that the checklist was managing. Here is what the research shows about the brain and cardiac health that the standard cardiology workup is not designed to investigate. There are 5 specific mechanisms through which a deteriorating brain directly drives and amplifies cardiac disease in adults over 60. Each one represents a failure point that no stent and no medication portfolio is designed to address at its source. Mechanism number 1, neuroinflammation and coronary artery destruction. Coronary artery disease is fundamentally an inflammatory condition. The plaques that build up in your coronary arteries and restrict blood flow to your heart muscle are not simply deposits of cholesterol. They are complex inflammatory lesions driven by chronic endothelial inflammation, immune cell infiltration, and oxidative stress within the arterial wall. And the primary driver of the systemic inflammation fueling this process in adults over 60 is neuroinflammation. When microglia, your brain's immune cells, become chronically activated, they release tumor necrosis factor, alpha, interleukin 1 beta, and interleukin 6 into the systemic circulation. These cytokines travel directly to the walls of your coronary arteries. They activate the endothelial cells lining those walls. They increase the permeability of the arterial wall to LDL cholesterol. They promote the recruitment of monocytes that transform into foam cells within the arterial wall. And they drive the inflammatory cascade that builds, expands, and destabilizes the coronary plaques that cause heart attacks. Your statin reduces LDL cholesterol and has some anti-inflammatory properties. It does not reduce microglial activation. It does not cross the blood-brain barrier in amounts sufficient to address the neuroinflammatory process driving the endothelial inflammation in your coronary arteries. A 2022 study published in the Journal of the American College of Cardiology found that neuroinflammatory markers specifically associated with microglial activation were independently predictive of major adverse cardiovascular events in adults over 65, even in patients on optimal statin therapy. Independently predictive, even with optimal statin therapy. The brain inflammation your statin cannot reach is still driving your coronary disease forward. Mechanism number 2, autonomic dysregulation and cardiac electrical instability. Your heart's rhythm is governed by its own internal electrical system, but that system operates under continuous modulation from your autonomic nervous system. The balance between sympathetic activation, which accelerates the heart and increases contractile force, and parasympathetic activation, which slows the heart and allows recovery, is maintained by continuous regulatory signals from your brain. In a healthy brain, this balance is precise and responsive. Heart rate variability, the natural subtle variation in the time between heartbeats, is high and reflects a well-regulated autonomic nervous system. When the autonomic regulatory centers in the brain deteriorate, heart rate variability drops. The sympathetic branch begins to dominate chronically. The heart beats faster than it needs to at rest, its electrical system becomes less stable, and the risk of arrhythmias, from atrial fibrillation to potentially life-threatening ventricular arrhythmias, increases dramatically. Bernard's arrhythmias that kept coming back despite antiarrhythmic medication were not a feature of his cardiac electrical system failing independently. They were the cardiac expression of an autonomic regulatory system in the brain that was no longer maintaining the balance his heart's electrical stability depended on. A 2021 study in heart rhythm found that reduced heart rate variability, the direct cardiac measurement of autonomic dysregulation, was associated with a 47% increased risk of major arrhythmia events in adults over 65, and that this risk was independent of and additive to traditional cardiac risk factors. Independent of and additive to, meaning your ECG and your echocardiogram did not capture it. It was in the brain the entire time. Mechanism number 3, the cortisol flood and the cardiac system that never rests. We have discussed the HPA axis in previous videos on this channel. But the consequences of cortisol dysregulation for the heart specifically deserve their own detailed examination. Your heart is designed to work harder during periods of genuine physiological or psychological threat and to rest and recover during periods of safety. That oscillation between exertion and rest is not just comfortable, it is biologically necessary for cardiac health. The myocardium, the heart muscle tissue, repairs micro-damage from exertion during periods of reduced demand. The coronary endothelium restores its protective nitric oxide production during periods of low cortisol. The cardiac inflammatory load is cleared during the recovery windows that a properly functioning stress response creates. When your brain's HPA axis becomes dysregulated due to neurological deterioration, those recovery windows disappear. Cortisol remains chronically elevated. Your heart never fully enters its repair and recovery mode. Your coronary endothelium never completes its nightly restoration. Your myocardium accumulates micro-damage that the chronic stress state prevents from being resolved. And over months and years, the cumulative cardiac consequence of a heart that never fully rests is profound and measurable. A 2023 study published in the European Heart Journal found that chronically elevated cortisol levels in adults over 65 were associated with a 53% increased risk of incident heart failure and a 39% increased risk of major adverse cardiac events over a 7-year follow-up period, 53% increased heart failure risk, from a hormone whose dysregulation originates in the brain and whose contribution to cardiac disease is not measured in any standard cardiology workup. Mechanism number 4, sleep deprivation and overnight cardiac destruction. The nocturnal cardiovascular recovery window is one of the most critical and most underappreciated aspects of cardiac health in adults over 60. During deep, slow-wave sleep, your heart rate reaches its lowest point of the 24-hour cycle. Blood pressure dips by 10 to 20% below daytime levels. The parasympathetic nervous system dominates completely, and the cardiac repair processes that maintain myocardial health, restore endothelial function, clear inflammatory burden from coronary tissue, and reset the electrical stability of the cardiac conduction system all operate at their highest efficiency when the brain can no longer generate adequate deep slow-wave sleep, as is the case in the majority of adults over 60. With any degree of neurological aging, these overnight cardiac repair processes are compressed or absent. The heart enters each day carrying the accumulated repair deficit of the night before. The inflammatory burden in the coronary arteries that should have been partially cleared overnight is still present. The endothelial nitric oxide that should have been restored is still depleted. The electrical stability that should have been reset is still compromised. Bernard's sleep had been fragmented for 5 years alongside his cardiac disease. Nobody had connected them. His cardiologist had never asked about his sleep. His sleep specialist, whom he did not have because nobody had referred him, had never asked about his heart. The connection between them was sitting in the medical literature and absent from every appointment Bernard had attended. Mechanism number 5, the vagal withdrawal and the inflammatory heart. The vagus nerve is the longest nerve in your body. It connects your brain to virtually every major organ, including your heart, your lungs, your digestive system, and your immune system. Through a process called the cholinergic anti-inflammatory pathway, the vagus nerve delivers direct anti-inflammatory signals to cardiac tissue and to the systemic immune cells that drive coronary artery inflammation. When vagal tone is high, when the parasympathetic nervous system is dominant and the vagus nerve is actively signaling, cardiac inflammation is suppressed, heart rate variability is high, and the cardiac environment is protective. When vagal tone is low, as it chronically is in adults with deteriorating brain health, autonomic dysregulation, and fragmented sleep, the anti-inflammatory protection the vagus nerve provides to the heart is withdrawn. Cardiac inflammation increases, heart rate variability drops, and the coronary inflammatory environment that drives plaque progression and destabilization becomes less regulated. Bernard's statin was managing his cholesterol. His ACE inhibitor was managing his blood pressure. His beta blocker was slowing his heart rate. Not one of his 4 medications was addressing the withdrawn vagal tone that was removing the only direct anti-inflammatory protection his coronary arteries received through his nervous system. A 2020 review in Nature Reviews Cardiology identified vagal withdrawal as a significant and systematically neglected contributor to cardiac inflammatory disease in older adults and called for the integration of vagal tone assessment into routine cardiac risk evaluation. Systematically neglected. In a review published in one of the most prestigious cardiology journals in the world. Type yes in the comments right now if your cardiologist has never once mentioned your brain in connection with your cardiac condition. I read every single one. Here is what you can do about the brain side of your cardiac condition that your current treatment is not reaching. These 5 interventions address the mechanisms your medication portfolio was never designed to touch. Intervention 1. Protect your nocturnal cardiac repair window with deep sleep. Every night of quality deep slow-wave sleep is a night your coronary endothelium partially restores its protective function, your cardiac inflammation partially clears, and your heart's electrical stability partially resets. 7 to 8 hours minimum. Consistent sleep and wake times every day, because your heart's circadian repair cycle is governed by the same biological clock that governs your sleep architecture, and disrupting one disrupts the other. Bedroom temperature 60 to 67 degrees Fahrenheit. No alcohol within 3 hours of bedtime because alcohol directly suppresses slow-wave sleep and simultaneously activates the sympathetic nervous system that prevents cardiac recovery. If your sleep is significantly fragmented, speak to your doctor about ambulatory cardiac monitoring during sleep to determine whether your cardiac events correlate with your worst sleep nights. For Bernard, the answer was yes. It almost always is. Intervention 2. Reduce neuroinflammation to protect your coronary arteries from the source. Extra virgin olive oil daily as your primary fat because oleocanthal directly suppresses the same inflammatory enzymes as NSAIDs through a mechanism that crosses the blood-brain barrier and reduces microglial activation at the source of the coronary inflammatory cascade. Fatty fish 2 to 3 times per week for EPA and DHA that reduce tumor necrosis factor alpha and interleukin-6 production both centrally and peripherally, attacking the inflammatory signal driving your coronary disease at both ends simultaneously. Deeply colored berries daily for anthocyanins that cross the blood-brain barrier, reduce microglial activation, and protect the endothelial cells, lining your coronary arteries from the oxidative stress that initiates plaque formation. Eliminate refined sugar aggressively because blood glucose spikes directly damage coronary endothelial cells through advanced glycation end products and simultaneously trigger neuroinflammatory cascades that increase the cytokine burden your coronary arteries are already managing. These are not heart diet recommendations. They are brain diet recommendations with direct coronary protection as their consequence. Intervention 3. 30 minutes of moderate aerobic exercise 5 days per week specifically for your vagal tone and your heart rate variability. Exercise is the most powerful non-pharmacological vagal tone restoration intervention available. It directly increases parasympathetic dominance, improves heart rate variability, and restores the anti-inflammatory vagal signaling to your coronary tissue that deteriorating brain health is withdrawing. It simultaneously reduces circulating neuroinflammatory cytokines, improves HPA axis regulation and cortisol responsiveness, promotes deep slow-wave sleep quality, and stimulates brain-derived neurotrophic factor that supports the neural health of the autonomic regulatory centers governing your cardiac electrical system. Every mechanism driving your cardiac disease from the brain side is addressed by walking 30 minutes 5 days per week in ways that none of your 4 medications can replicate. Your cardiologist may have mentioned exercise. Almost certainly, they did not explain it through the brain mechanisms that make it your most powerful cardiac intervention. Intervention 4. Restore your vagal tone through specific daily practices. Slow diaphragmatic breathing at a rate of approximately 6 breaths per minute for 10 minutes daily has been shown in multiple randomized controlled trials to measurably increase heart rate variability, reduce resting heart rate, lower blood pressure, and reduce circulating inflammatory markers in adults with cardiac disease. The mechanism is direct vagal activation. You are manually stimulating the same anti-inflammatory pathway that your deteriorating brain is failing to maintain automatically. Cold water face immersion for 30 seconds daily activates the diving reflex through the trigeminal nerve and produces immediate vagal activation measurable on cardiac monitoring. Tai Chi practiced 3 times per week has been shown in cardiac rehabilitation research to improve heart rate variability and reduce cardiac inflammatory markers to a degree comparable to pharmaceutical intervention in adults over 60 with established cardiac disease. These are not relaxation techniques. They are direct vagal pharmacology delivered through your nervous system rather than through a prescription. Intervention 5. Have a completely different conversation at your next cardiology appointment. Ask specifically whether your heart rate variability has ever been measured as part of your cardiac assessment, because this single measurement captures your autonomic regulatory function and vagal tone and predicts cardiac events independently of every test your cardiologist already runs. Ask whether your neuroinflammatory markers have ever been measured alongside your standard lipid panel and cardiac inflammatory markers. Ask whether your sleep architecture has ever been formally assessed in the context of your cardiac disease, because the correlation between sleep fragmentation and cardiac events in adults over 60 is among the most robustly established findings in cardiovascular medicine. Ask whether a cognitive baseline assessment has ever been included in your cardiac workup. These questions do not challenge your cardiologist's competence. They expand the frame of your cardiac care from the heart to the system governing the heart. I want to close with this. Bernard, the retired civil engineer from Birmingham, 5 years of optimal cardiac management, 5 years of a protocol that addressed his heart from every angle cardiology had available, and a heart that was still not right. He eventually asked one question his cardiologist had not been asked before. He asked whether his brain had ever been considered as part of his cardiac picture. His cardiologist paused, really paused, and said, honestly, no. They measured his heart rate variability for the first time and found it severely reduced. They assessed his sleep architecture and found virtually absent slow-wave sleep. They measured his neuroinflammatory markers and found them significantly elevated despite 5 years of statin therapy. His cardiac treatment did not change that day. His brain treatment began. Sleep, exercise, dietary change, vagal tone restoration, neuroinflammatory reduction. Within 8 months, his heart rate variability had measurably improved. His inflammatory markers were lower than they had been at any point in 5 years of statin therapy. His angina frequency had reduced by more than half. His cardiologist called it unexpectedly good progress. Bernard called it treating the right organ. Your heart is not failing because your heart is broken. Your heart is failing because the organ sending it instructions has been struggling for years and nobody looked up. You now have 5 mechanisms that explain exactly how. 5 interventions that address the brain side of your cardiac disease that your cardiologist has never prescribed, and the questions to take into your next appointment that could change the entire direction of your treatment. If this changed how you think about your heart condition, please subscribe. This channel exists to show you what a rushed appointment never will. Share this with someone whose cardiac condition has never been fully controlled despite years of optimal treatment. What you share today might change what happens at their next appointment. Leave a comment below. Type yes. If your cardiologist has never once mentioned your brain, tell me how many years you have been managing your cardiac condition and whether it has ever been fully under control. I read every single one. This is Dr. Angela Whitfield, and I will see you in the next one.